Thank you, HITLAB. You have given me so many opportunities on this platform to share with your community. My name is Dr. Kate Stephenson. I'm a 25-year veteran of the medical device industry, primarily in startups. I've been in Silicon Valley since the late 90s. And so this has been my happy place, is playing with technology, new ideas, figuring out where there's the underserved population, diving in and trying to take that new technology and to serve the needs of that population.
Well, my background has mostly been with the drug industry and with medical devices. I've worked in commercialization, reimbursement, and strategies for companies such as Amgen, Bristol Myers Squibb, Glaxo, and the Alfred Mann Foundation. I've also worked with hospitals like the Children's Hospital of Los Angeles, and I'm a consultant for the Pediatric MedTech Accelerator CTIP. So I work in pediatrics with Children's Hospital.
We are in the vaginal infection space. 30 million plus women in the US every year will go to the doctors for a prescription to deal with one of these infections. It's one of those nasty little unmet needs in our industry that has gone unmet for a very long time. And what Cern is doing is we are coming up with the first non-drug treatment for both bacterial infections, yeast infections, combination infections, and including all those infections that are emerging now that are actually drug resistant. So we have a basic little glowing device that is a simple treatment you use at home. It's a prescription based, it's trained in the office. A lot of amazing potential opportunities as far as reproductive health, as far as women's health, oncology. One of the nasty side effects of all those amazing new immune therapies is you get horrible yeast infections. Because we've talked about before, like I did not realize that drug resistance is something you can develop over time. And so even if the doctor only sees you once, they're not going to be thinking about that. But the payer, they've got this whole community of women who they know over their lifetime, their risk of getting these nastier and nastier infections down the line are going to start showing up.
COVID really made a big difference to remote monitoring, and I think that's really here to stay, even though the government only extended some of these remote monitoring for another 2 years. They didn't make it permanent that they could have done. So one takeaway I would say is reimbursement is not really keeping up with the technology, but it's trying to. It's kind of catching up. Reimbursement is still getting to grips on the use of AI, but maybe in a few years' time it will have caught up.